Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
the measurement of the solute concentration. In this measurement, most important is osmolar gap. Okay, osmolar gap is actually an accurate way. It is an accurate way of determining the osmolality. Osmolality. So the most accurate way of determining the osmolality is by the freezing point depression. So most accurate way for measuring the osmolality is freezing point depression. Now, if the now after that, if the difference between the most accurate way of determining osmolality is by freezing point depression. So, one, we can use freezing point depression. Second, we can also use this formula for measuring the plasma osmolarity, which is 2 times sodium and potassium concentration plus glucose in milligram per deciliter divided by 18 plus blood urea nitrogen in milligram per deciliter divided by 2.8. If the difference between these two calculations is found to be more than 10 milliosmoles, then it is said to be osmolar gap. This osmolar gap states that there is presence of some. This osmolar gap will actually reflects the presence of some foreign substance. Like the foreign substance can be anything. It can be either ethanol or methanol. It can be either ethanol or methanol. It can also be some of the poisonous substances like ethyl glycol, and also methanol are also the mannitol and methanol are also the osmolar are also responsible for osmolar gap.
thank you and thank you for watching.